Our next speaker is Emiel DenHartog. He's going to bring us up to date on classification and evaluation of general purpose face coverings. Emiel?
Yes, thank you very much, Dan, and thank you, Jim, for a great introduction and then reminder of PPE and source control and the importance of that. My background is also in personal protective clothing, a lot broader than respiratory protection alone. Next slide, please. And during this COVID crisis, being in the College of Textiles, we received a lot of requests from textile manufacturers realizing that there was not a lot of guidance if they wanted to shift their production lines to making general purpose face coverings, trying to get a better understanding of what surgical medical masks are and even what N95 respirators are. So with all that and being there no guidance or standards for any of that, there was a discussion with a group of volunteers from AATCC, which is the American Association of Textile Chemists and Colorists, people from some test institutes, people from our college, and a few other volunteers to try to help guide the textile industry to come up with some voluntary consensus standard, although as it was a small lenient group, consensus standard is probably not the appropriate term here, but at least trying to help them understand what they would need to do to make general purpose face coverings that might serve the public to some extent. Next slide, please. So if we do that, we need to understand why that be necessary. And I think I don't need to stay long on this slide because we have talked a lot about the occupational side of the house. On the right side, what we try to do is explore what is available on the occupational side from NIOSH and NPPTL, but also what was available internationally. And through March and April, we saw a lot of voluntary guidance documents coming out, especially in Europe, trying to do the similar thing and helping the textile industry and helping manufacturers to produce face masks and cloth face masks specifically that should have some benefit to the user. As a PPE scientist, I tend to be extremely careful with the statement that anything is better than nothing, because we have seen many examples where anything can actually be worsening the exposure or the risk to people. There's many reasons for that. One is already been addressed yesterday as well. It's a false sense of security, but also the materials itself can contribute if they are not designed well. So trying to build on what happened internationally and what was around us, we worked on developing some guidance for the industry. Next slide, please. So based on things that are available and ASTM tests that were available, we developed a monograph. It is currently available on the link above. It's available for free. You have to go into the AHCC website, but you can uncover that. And again, it is written for the textile industry and not for end users. There's a significant amount of discussion in the inner group was dedicated to that, because one of the topics I think Jim and people also raised yesterday, there is a lot of education that will be needed for the public to make sure that these things are used correctly, as we all know is common with any type of product that is supposed to provide some health benefit or protection. So we, besides all types of labeling and technical requirements, which you can find in the monograph, I'm just highlighting the two technical specifications we have. One, obviously, on filtration efficiency. You want to know that your fabric filters a certain amount of particles or droplets. And the other is air permeability. And I think I saw a question this morning. What we see a lot is people trying to achieve a certain level of filtration. And I'll get back to the numbers of 70% and 3 micron here in a bit. But then we need to make sure that people can actually breathe through it. Internationally, there's 3 standards on that, as you see below. They all do basic air permeability tests, how many airflow will pass through a fabric or a fabric assembly at a certain pressure. We tried to provide guidance so you can actually calculate them back and forth between the different numbers, and they should correspond roughly between what is classically in the EN standard and what NIOSH requires for their NPPTL certification standard. The discussion on filtration has taken a long time. What you see here is a filtration efficiency of more than 70% with 3 micron particles. That is a very, very low bar to jump over. What that would do to the public is basically just larger droplet filtration and blocking, hopefully. And in the future, if we would look at smoke or pollution, it would be, let's say, 2.5 micron and up particle size that would be filtered through the fabric. As you see, there is no fit requirement here, and I go back to that as well. The 70% is also somewhat random, if you will, but it was based on the European guidance. Pretty much all European countries came with their separate standards. SEN, as Jeff explained, as the European standardization group, came out in July with a coordinated document. They refer to these numbers. And I think that's where you can start to say anything is better than nothing if you would hit these requirements. We try to provide some guidance, general fit, but as we did not have a standard available for that, there's no ASTM standard that we were aware of. We just gave some general paragraph of text to guidance that people should be looking at it and should address the fit of the mask on the person, but we're not able to add much more than that. We generally describe this as just a first stab at this big problem and are happy now to hand it over to ASTM, where John Salata will take this further to a more technical detail, provide more background and guidance to it. Next slide, please. So a little bit on cloth masks. You see a couple of pictures here, and we need to understand that if we go away from the technical filtration fabrics as they are used in N95s, which are based on non-woven fabrics, and with the 3 color graphs you see on the left in the middle, the right side with the random little rods, if you will, is a random fiber net that is a schematic representation of what a non-woven filtration fabric is. Because of that fine distribution of fine fibers that are also charged, and I will not go into the details of fabric filtration. That is for another day. We don't have time for that. But because of that, it has very specific structure and properties that will make it work well as a cheap and very effective filter. If we go to general cloth as they are used, on the left you see woven fabrics, and in the middle you see knit fabrics. They have a very different structure, are not as random, and therefore we need to be extremely careful on how we need to design them to provide any chance of filtration. A lot is to do with the effective, standardized, regular structure, which may have it act like a sieve much more than a non-woven would do, which is a true filter. On the right side, you see some blown up microscopic images of individual yarns. As you can see, they consist of different fibers. And even if you would go to the left structures, depending on which type of yarn you would be using, that exact same structure would give you different filtration properties. That is the reason why, and I think one of the speakers yesterday brought that up, a cloth, even when it's saying just it's a 1-layer knit fabric, or even if it's more specific, it's a 1-layer jersey knit or a 2-layer jersey knit, and it gives you some more fabric properties, still does not specify it enough to be able to predict its filtration efficiency. So obviously the big question we receive from the textile industry, tell me what we should be making. The science, we're trying to start that up right now, is just not there because it's been developed for non-woven filtration fabric and not for regular knit and woven fabrics. And obviously, if you stack layers, you will start getting better filtration performance, but you will see that the breathing resistance increases and it becomes extremely hard to breathe through that. So we are hoping that we can start work on that, but we just need to test fabrics now before we can say anything about their filtration efficiency. Next slide, please. And this is just one example of what may be useful and not. This is just a set of fabrics and materials that we've tested in our lab. On the x-axis from left to right, you see a logarithmic scale on the micron side of particles. And on the y-axis, you see filtration efficiency. So 100% is really, really good. And you see the N95 mask that did quite well in our filtration test. I added the vertical 3-micron line to show you that many fabrics start to have a big problem in filtrating true aerosols and small particles. So really the general purpose face mask is for the larger droplets that are 3-micron and up and that may not travel as far and not be suspended as far. And probably if you get into technical details, you should be talking about small droplets rather than aerosols, which would be suspending in air for a larger period of time. For that, we really would be looking at the smaller sub-micron particle size. And as you may recall, the NPPTL tests are in the range of 0.1 to 0.5 range. because 0.3, again, it's a technical reason why that 0.3 micron comes up every time, because filters, technical filter media, have a very hard time filtering those. So that is the most challenging size to actually filter. And you see that cloth fabrics do a very poor job in that range, which is the aerosolized particle range. Next slide, please. And again, on the right side, you see a picture that we took in our lab. It's a fairly cheap surgical mask type of thing. I'm not going to go into detail what it is, but if you look carefully in the mannequin right eye, which is to the audience probably on your left, you see a little bit of a fuzz there, which is actually the smoke that escapes. And pretty much that tells you how important fit is, and the way we try to people. As you can see, probably I wear glasses. If your glasses fog up, your fit is not appropriate, because the airflow is going around your mask and not through your mask. So a lot of people are also trying to be creative in pockets with filters, or even you start seeing now small plastic pieces in the center that allow your mouth to be seen for people to be used. All that means that the airflow, including the aerosols, will be diverted elsewhere and might then not reduce the spreading at all. And I think that's just adding to what's been said many times already today. Next slide, please. So general idea, face coverings are not PPE, but they should help reduce the aerosol exposure. So I have to admit, early on in the COVID pandemic, I was also saying that these general purpose masks are not doing anything because they're not protecting. As a PPE scientist, we're used to looking at 95, 99, 99.9% protection, because we are trained to study how we can protect people that go into a known hazardous environments like first responders and chemical crews, et cetera, et cetera. However, if we shift our perspective to the public health, it may be cynical, and the numbers you see here are probably by definition wrong, but just to give you food for thought, if you would have a minimal effective cloth mask that just gives you a 20% reduction in exposure to the person, because either the wearer is not expelling as much or the person is not breathing as much from his or her environment, if you would have an exposure of 10 million people, now you avoided 2 million people to be exposed. If you have a 0.2% mortality rate, which is, I think it may be higher for COVID for the general population, you have a couple thousand lives saved. So I actually changed my communications and my thought process in that if it's not PPE, it does not mean it's not effective, especially from a public health perspective. I'm happy to be entertained and learn more about the infectious dose of small aerosols and larger droplets and what the infectious dose of all those would be. But I think this is a different way of looking at it and may help explain to the public why the face coverings might still help, in addition to the very important 6 feet distancing. Next slide, please. This was pretty much what I had. Yes, thank you for your attention, and I'm happy to entertain any questions that come up later. Thank you.